Hi everyone, this is Jody Tropiano, the Content Director for Health, and I'm lucky to be here with Nancy Brown, the CEO of the American Heart Association, and Dr. Bob Harrington, the President of the American Heart Association. So thank you both for joining us.
Thank you for having us.
So we're going to chat a little bit about the COVID pandemic and chat specifically about what the AHA has been up to. So first, we'd just love to open it up to the two of you to give any opening remarks on kind of what your thoughts and feelings are during this uncertain time.
Sure. Maybe I'll pop in and just say that the COVID-19 pandemic has had an unprecedented impact on the work of the American Heart Association and the people we serve here in the United States and around the world. Our mission is to be a relentless force for a world of longer, healthier lives. And this pandemic has really shown that the power of the American Heart Association's science, our brand, and our grassroots reach is really becoming quite important as we provide all of the resources we can to help.
And I'll add in from the science side that the AHA, the very foundation of what we do and what guides us is our science. And in a time of a pandemic that is affecting communities, is affecting healthcare systems, healthcare workers, all of our citizens, we really feel an obligation as a science-driven organization to get credible, evidence-based information out to frontline practitioners, to policymakers, to really be able to opine on the things that we're expert in, which is the care of patients with cardiovascular disease and stroke, and the science that underlines that care that we recommend be delivered. So for us, this is a critically important time for our scientists to really help lead some of the efforts in the public space.
And touching on that science, I know you have a research initiative going on right now to investigate the cardiovascular and cerebrovascular implications of the virus. So can you touch on that a bit?
Sure. You know, when patients first started presenting in hospitals, out on the West Coast and as it moved to the East Coast, many of our science leaders were quite alarmed with what they were seeing. They were seeing patients, obviously people who were already at higher risk with chronic diseases or underlying health conditions like hypertension, obesity, type 2 diabetes, being more at risk. But they also saw that patients, when they were in the hospital, many were developing myocarditis, or the virus was spreading to the heart or to the brain stem, leading to fatal arrhythmias. And one of our scientists called us up and said, we need to do something about this. We need to understand this. And so within a day or so, the governing body of the AHA, of which Bob is the president, made the decision that we would commit $2.5 million and fund 10 or 15 rapid action grants, as well as a data coordinating center to try to understand why this phenomena was happening. And Bob, I know, will be excited to tell you what has happened since we launched the grants, but just a little about the process. We gave folks only 2 weeks to give us their idea on 3 sheets of paper or less, which is not the normal academic way. And the response has been overwhelming. So Bob, maybe you want to take it from there.
Yeah, I think what you really saw in this response was the best of the American Heart Association with regard to our science first sort of ethos. And what we really saw was an outpouring of interest from the science community. We have 40,000 science volunteers across 16 science councils in the Heart Association. We are a big group of scientists from around the globe. And what we saw in this short period of time that Nancy mentioned is over 700 applications come in for these 10 to 15 grants, which tells you that there's a lot of interest in the community about trying to solve some of the problems that people on the front lines are seeing, and some of them that Nancy already alluded to. So that came in, and we're in the process of reviewing them now. In fact, Nancy and I will be spending part of our weekend reviewing the final grouping of them. What's been really interesting is that we have over 100, I think it's close to 150 of our volunteers who said, I will take time away from what I'm doing right now to help you review these grants. And then a smaller group of us will review the final grouping over the weekend. There's also been a large number of our colleagues who run data coordinating centers around the country who also submitted an application that said, let us serve to link together all of this information so that we can build scientific synergies and we can disseminate the information as rapidly as possible to the people that really need it, which is the people taking care of the patients at the front line.
That's great. And so with what is known now about the virus, I know there's still a ton that is unknown, but with what is known now, how are you guiding people with chronic cardiovascular disease in staying healthy?
We learned early on from the cases that were coming out of China and South Korea that patients who had underlying cardiovascular diseases, heart failure, coronary artery disease, hypertension, as well as some of the associated diseases that lead to cardiovascular disease, things like chronic obstructive lung disease, diabetes, that those patients had two issues that we really need to keep in mind for this conversation. Number one, they were at greater risk of infectivity. And number two, if they became infected with coronavirus, they were at increased risk for death. And so what we really early on as an organization said, we've got to be on top of this, and we've got to first let our community know. And when I say our community, I do mean our scientists and our doctors, but I also mean our patients and the public that we serve who are very interested in trying to reduce the risks of cardiovascular disease and stroke. So we needed to let people know that these risks are out there. And the organization has done a fantastic job of putting forward a series of both scientific and clinical documents, but also public-facing documents that I think Nancy's going to talk a bit more about, to really let our communities know what we know about the disease and how we might help keep people safe.
I would just add on to that, as Bob said, one of the beauties of the American Heart Association is we create science and then we translate it to the lay public, consumers, patients, and other caregivers and other critically important people. And as so many people have wanted to understand how their pre-existing health condition might put them more at risk, we also have this whole population of people suddenly working at home. And, there's a science around how to stay healthy as well, mental health, physical activity, nutrition. And so we've really marshaled the entire marketing arm of the AHA to create content that is fun and actionable. This morning, many of us started out with a fit moment, a 30-minute fitness workout that was a virtual live online workout led by folks that the AHA is recruiting. And so, we're trying to marry the hard science for COVID-19 with the science translated to consumers for what they can do to be healthy while sheltering at home.
Great. And so if someone is experiencing symptoms, I know a lot of times you are able to recover at home, but what key symptoms would you say are cause to then go to the hospital?
Yeah, so great question. And what we're saying is that if you have mild symptoms, perhaps a bit of a cough, a fever, you should call your primary care provider and talk to them, explain to them systems. Most healthcare systems now are screening people via telephone, via video visits, and using that opportunity to really triage. There'll be a group of people who call and have a certain constellation of symptoms, which we may refer on to screening, to testing. In that group, they're often around the country using mobile testing sites, so people can really stay, in some ways, isolated from others in the community. If symptoms are worse, if you have extreme shortness of breath, if you have chest pain, if you have dizziness, if you have the kind of symptoms that portend some sort of cardiovascular complication or some sort of lung complication, then you should seek more urgent help. And that would be either via the emergency medical services or via calling 911. Important that you let dispatchers know what kind of symptoms you have, because part of all of this is that we also need to protect our frontline first responders, and they need to come into a situation aware of what those symptoms might be. We want people, one of the areas that has been noted is that there's been a decreased number of heart attack patients and stroke patients seeking care. And we think that's because people in part are staying home, afraid to seek emergency medical services because they don't want to become infected. We would say and stress as an organization, no, if you have symptoms that sound like a heart attack, that might be referable to a stroke, seek emergency care. We are here in the healthcare systems to help and to provide care, not just for our patients who might be infected with coronavirus, but for people who have chronic and acute conditions as well.
It's important information. So you touched on mental health earlier, and I know stress and anxiety could lead to heart disease. So, obviously these are very stressful times for everyone. So how is the AHA guiding people in regards to mental health and staying mentally fit during this time?
Such an important topic, and one that the American Heart Association has cared about for several years. Actually, we have a group of CEOs of large businesses in this country called this AHA CEO Roundtable, led by Brian Moynihan, the CEO of Bank of America, and Alex Gorski, the CEO of Johnson & Johnson. And this is top of the agenda of this group of CEOs. And so for the past several years, we've been adding to the body of science about both mental health and also resilience. The positive way to think about it is how to build resilience, especially during stressful times. And we know, just as an example, even before the coronavirus, through surveying we have done through employees and companies in America, that 72% of people pre-coronavirus said that on any given 3 days out of 5 in a week, they felt anxious, depressed, or had concerns that would cause them to say that they had an elevated concern about their mental health. And so you now add on this worldwide pandemic and so much uncertainty, we recognize, that mental health is really an important issue. So we've been working very diligently at the American Heart Association to take the content and the science we already know and have invested in about how to help people think about their own mental health. And so, first of all, it's to take away any stigma that if you feel anxious or depressed, that something is wrong with you and and because that is, that's not true. So, erasing the stigma is important, making sure that people know how important it is to talk to other people. But then things like physical activity, meditation, yoga, having someone to talk to. We have a group of support networks where people can, it's virtual, just like this, so people can be online talking with each other. And they were largely set up initially around conditions. So people who've had a stroke or stroke caregivers, people with atrial fibrillation, people who've had a valve replacement, people who've had a heart attack. But what we're finding is that, many people are entering into these communities just wanting someone to connect with. And that's what we would say. So we're working very hard to take what we know and bring it into action and even more into the forefront now. The other thing I might add is for companies, we've created a content bundle, if you will, that we are giving to all of our companies that are involved with the AHA. Tens of thousands of companies participate with the AHA in communities throughout this country every year, and we're giving them content on mental health, stress reduction, anxiety, nutrition, fitness that they can take, sourced as the AHA, but they can brand it with their company, name and send it out to their employees. And we've had a wonderful uptick from that as well.
And I'm sure a lot of those solutions are digital in nature.
Yeah.
So how else do you think digital health has really stepped up during this time in aiding both patients and the health systems?
Yeah, the country has for a long time wanted to push forward with digital technology as a way of increasing access, as a way of something we like to say in the AHA, which is meeting people where they are, where they live. And so things like telemedicine had been long hoped for, but it took a pandemic, didn't it, to really push it to the forefront and push it to the forefront really rapidly. So what we've seen is that over the course of the last month, many healthcare systems, including our own, are now doing 70+% of the ambulatory visits are now via video. That's extraordinary, because if you think, just 6 weeks ago, most health systems were doing very little of this. So there's been a real change, which I would say is for the positive. And one of the things we want to do is make sure we don't go back. What the Heart Association has done is really step to the forefront of this. We have long been promoting the use of telemedicine as a way to reach people who might not otherwise be able to have that level of care. We've pushed for things like telecardiac rehab, and we've advocated for legislation and regulations that would provide reimbursement for that. We have long advocated for our fellow citizens who live in rural America for better use of better infrastructure that would provide broadband in these communities, that will allow them to have better Wi-Fi and access maybe to major medical centers that largely exist in the urban centers. So we as an organization have been very, very involved with the telemedicine prioritization in the country. And now we see through the pandemic that it's coming out in front. Nancy, you might want to mention our commitment both to health technology as well as to our most recent strategically focused research network.
Yes, absolutely. Thank you, Bob. We, prior to the COVID-19 pandemic, because we have appreciated so much the role of health technology in furthering health and well-being in this country for patients, the public, as well as our healthcare providers, we recognized that there was an opportunity to learn even more about which of these solutions work best. And so we launched last fall and recently announced Centers for Health Technology, 4 Centers for Health Technology and Innovation housed at academic medical centers in this country, that these centers will receive several $1 million each to study projects that they have initiated that we think are fantastic, that help with this intersection of patient empowerment and provider, new ways of providing care. These centers happened to be announced right at the time of the pandemic. So we also offered each of them an opportunity to get a supplement to their existing grant to focus on COVID-19 health technology. And those are part of what the grants Bob and I will be spending the weekend on, because they've each submitted their supplement to give us their ideas, and we need to say if we agree with them or not. And so, this really is at the fabric of what we do at the AHA scientifically, and then also to help consumers and the public feel comfortable with with technology and how it can be used to inspire their health.
So we've touched on a ton that you guys are doing already, but on top of that, how else are you aiding health systems? Are there any specific resources available to them? We know they're stretched very thin right now. So anything you can share in regards to that?
Yeah, a couple of things I might mention. First of all, what you may or may not know that the American Heart Association provides over 90% of America's healthcare providers with their CPR and first aid training. And this is an important part of the heritage of the AHA. It has been a core part of our business for years, both here in the US and around the world. And what we recognized early on is that many non-emergency providers were being called to the front line to care for these patients. And so we created custom courses around ventilation and airway management, respiratory management that could be, that were online and quick to use for people who maybe were going to be facing those challenges and needed to either learn those skills or brush up on those skills. We also, we just launched yesterday a Better Business Exchange, where we're allowing individuals who have things to contribute, whether it's PPE or food for healthcare workers, with people who need things. So kind of a platform where the giving and the needing can come together, and we're very excited about that, and we believe that will benefit our healthcare providers as well. And Bob, you might want to talk about the registry.
Yeah, so on the science front, as Nancy has indicated, the AHA, we have long had relationships with close to 2,500 US hospitals, as well as a group of hospitals around the globe, where we have set up registries that are disease or condition specific to be able to capture information in real time that then, when aggregated, can provide us some insights into who these patients are, how they're being cared for, what might be the optimal way of caring for them, and then feeding it back in a very quality improvement sort of methodology. That's a longstanding goal of the AHA, and we've really been leaders in it for a long time. With this, again, as Nancy indicated, as what happened with our science volunteer calling and recommending that we get involved with funding research, another longstanding science volunteer submitted to us over the weekend, a few weeks back, a proposal to expand our registries to focus specifically on COVID-19. Literally within a couple of days, AHA responded to that opportunity. We thought it was a great idea. We assigned a science team to work on it. We assigned experts from the registry world to work on it. And within a week, we had launched a new program where our Get With the Guidelines registry would have a COVID-19 specific set of modules that would allow us as a community to gain more information about these patients, how they're cared for, their outcomes, so that we can really learn about particularly the cardiovascular and brain health complications of the disease, which really looks to be some of the most serious conditions involved with the diseases.
That's great. We'll make sure we share those resources on our health resource page.
Great.
Those seem, especially that platform. That's wonderful that you're doing that. So we'll make sure to share it. And you mentioned CPR training a bit. So can you touch on that a bit more? I imagine now there's been a huge uptick in CPR training. So why is that really crucial during this time?
You know, CPR training for healthcare providers and lay people is always important. You know, if someone suffers a sudden cardiac arrest, early and immediate resuscitation is critical to their survival, and so it is very important. That lay people like all of us know CPR as well. Mm-hmm. So we, during this time, especially as Bob mentioned, when people may be sheltering in place, perhaps having cardiac arrests at home, heart attacks at home, we need to be sure that people are well aware. And for the public, during this time, and actually all the time, we have a hands-only CPR technology that people can access online that teaches you how to do hands-only CPR that should be initiated immediately upon a person's sign of having a heart attack after dialing 911 and getting urgent care on the way. So we would say that during this time, it's very important. One of the courses we've released this week for healthcare providers is CPR and the COVID-19 patient. So if an emergency responder appears with someone who has tested positive for COVID-19 and is having a heart attack, how should that CPR be administered? That's additional science that the AHA released this week.
And so what advice would you give to anyone? So it doesn't even have to be someone with previous conditions, but even me at home by myself in New York, just that maintain good heart health right now, knowing that you want to build up your immunity and make sure that you remain healthy across the board.
Yeah, I think you've hit it perfectly, which is that we want to worry about our patients who have pre-existing cardiovascular disease. And the message I want to deliver to them, first and foremost, keep taking your medications, keep following the instructions of your healthcare providers. There's been some misinformation going around as to whether or not people should stop some certain medications for control of blood pressure, for control of heart failure. And the answer is no. Do not stop any of your medications without talking to your doctor, without talking to your advanced care providers. So please, that we want to get that message out. Now, for the larger general population who don't have cardiovascular disease, we want you to maintain heart health, and that's heart healthy living. We call it Life Simple 7. We want you to eat right, get enough sleep. Even in these difficult situations, try to get physical activity. Please don't smoke, don't start smoking. Good opportunity while at home to refrain from smoking. So really the key things that we're concerned about are the things that we've always talked about, which is the lifestyle of that can really help reduce both the risk of cardiovascular disease and stroke, but also then the complications thereof. So a good time to focus on some of these issues, as hard as it is. Nancy also mentioned the stress piece, and that's obviously critically important as well. We know that there is a mind-heart interface that is very real, and that does increase the risk of heart disease. And so stress management, oftentimes through things, as Nancy said, like things like exercise, meditation, taking a moment for yourself. And then the final thing I'll say is that in the midst of all of this, listen to what our public health officials are telling us. Wear a mask if you go outside. Wash your hands frequently. If you need to cough or sneeze, the new into your sleeve, do not shake hands. A nice touching of the heart or a bowing of the head is a fine way to greet somebody, and do it outside of the 6 feet of distance. So take those public health social distancing pieces of advice really seriously. And we're all in this together, and we can help protect each other.
And I would just add to that, as always, well said by Dr. Harrington, many of these resources can be found at heart.org, which is the American Heart Association's website. And we have so many tools, interactive ways to, when you're sheltering at home, to find some folks to exercise with, to get some new recipes, to get healthy tips, and of course, to find those COVID-19 specific health precautions that Bob just mentioned.
And so any other information that we didn't cover that you really want to make sure gets out there to our audience?
I'd just quickly say, to reiterate Nancy's point, we have a lot of resources available to medical professionals on our professional Heart Daily website. We have a lot of materials related to things that are COVID specific, such as recommendations and advice on use of medications like hydroxychloroquine and azithromycin. We have statements around the importance of PPE. We have statements around the importance of protecting our medical students and our medical trainees. Please do go to our professional website to get that information. Nancy has already indicated a lot of the information we also have available on our more public-facing websites to be able to share that information as well.
And I would just, to your audience who are amazing health technologists and people who care about health and well-being, I would just like to say thank you for, for the innovation and for the new ideas. At the AHA, we recognize the power of technology to help people live longer lives and to help the country through crises like this one we're facing right now. And we are excited to partner and to share and to learn as well. So thank you for this opportunity.
Of course. Well, thank you both so much. And thank you for all the amazing work that you've been doing. And good luck this weekend reviewing the proposals. We look forward to seeing what comes out of that. I'm sure it'll be incredible. So thank you both for your time.
Thank
you. Thank you for having us.
Thanks for watching this interview. We're doing our best to keep our health community up to date and informed as the pandemic progresses. So please check back for more interviews and blog pieces with leading health experts, as well as check out our Health COVID resource page for more information. Thanks again.